much for holding this hearing and for the opportunity to testify. My name is Cynthia Hallett, and I am President and CEO of Americans for Nonsmokers Rights. We are a member-supported advocacy organization established in 1976 to clear the air of secondhand smoke and to protect everyone so that they have the right to breathe what we used to call clean indoor air and now smoke-free indoor air. I did just celebrate my 25th anniversary with the organization, but prior to that was a research fellow at the National Cancer Institute, working in cancer control and prevention. And so my background is in public health. My purpose is to protect lives and prevent cancer. Today I am here to give you some commentary and some information about the importance of protecting everyone's right to breathe smoke-free air. We've worked for nearly half a century to breathe so that everyone can breathe non-toxic air in workplaces and public places, offices, airplanes, restaurants, bars, and casinos. In fact, it was New Jersey State Senator Frank Lautenberg who championed the Smoke-Free Skies bill 33 years ago. And at the time, we were told no one would fly. But again, 33 years later, we still have people traveling by air on smoke-free airplanes. And today, similarly, casino workers are now looking for those same protections that every other worker in the state has. 21 states, 3 municipalities, and over 160 tribal casinos operate smoke-free casinos. And it's time for New Jersey to close the loophole and catch up with all of these other states, including their regional competitors in Delaware, Maryland, Connecticut, New Jersey, and as you've heard, some properties in Pennsylvania. I'm so proud of workers from CEAS who are the parties who are involved in this issue and being exposed. I don't know how anyone can listen to the stories that you've heard today from Pete, Lamont, Nicole, Tammy, Bev, and others about how their lives have been hurt by doing a job that they love. It takes a special person to work in a casino and to entertain people and then also have the skill to run the games properly. So I have to ask the question, if their lives aren't enough to convince you that this is the right thing to do now, I don't know what is. We've seen a lot of studies that have been brought to us by the industry. As I said, I've been doing this work for 3 decades and dealt with a lot of opposition and interference from the industry, both tobacco and casino. We've seen studies that are bought and paid by the casinos themselves that grossly mislead on the economic consequences. We see studies that are more than a decade old that came out prior to COVID-19, which that pandemic changed everything. And then there's a study that admits that casinos rely on people with gambling addiction for disproportionate share of profits. That's not fair. There's been a clear pattern that it's emerged in New Jersey amongst their casino executives, lobbyists, and other third-party endorsers. Time after time, Atlantic City casinos make claims that turn out to be false. And then they turn to the next weak argument to defend indoor smoking. Now, the casinos will tell you that revenue hasn't recovered from pre-pandemic levels, but then they break or tie all-time revenue records in each of the last 2 years. The casinos will say that actually in-person revenue is what matters, and that hasn't recovered. But then they exceed the pre-pandemic in-person revenue figures for 2022. The casinos will tell you that they'll have to cut jobs. But then you'll read from the press of Atlantic City last week that they can't even find workers to fill the existing job openings. You're going to hear that expensive state-of-the-art ventilation, or you've already heard that state-of-the-art ventilation will actually keep workers safe. But then the experts who build those ventilation systems or set the standards for acceptable indoor air quality tell the casinos that they're wrong and that they have no business making such claims. Casinos will tell you that only 25% of the gaming floor allows smoking, but there's no separate sections between smoking and non-smoking. They're side by side and interspersed across the whole gaming floor. So there's no method of separating them, which then means 100% of the gaming floor is filled with smoke. Yeah, so we all know the right answer on this issue. It's not even debatable, so let's get this done. The casinos know how to operationalize this quickly. They experienced being smoke-free during the pandemic. They can move now and adjust on how every other business should operate in 2023. It's not every day or with every piece of legislation that you can tangibly improve the lives of thousands of New Jerseyans. S-264 is one of those bills. Thank you.